Welcome to today's video about early symptoms of stroke. Every 40 seconds, someone in the US has a stroke. But what if you could spot it before it fully strikes? What if the power to prevent a life-changing event was in the subtle signs? From sudden speech troubles to unexpected seizures, the signs are there if you know where to look. But how do these signs connect to the inner workings of our brain? And why do some people experience them while others don't? Stick with us as we unravel the mysteries of the early signs of stroke, backed by the latest research. You won't want to miss this. Please note, this content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider regarding any medical conditions or concerns. Without further ado, let's unveil the early signs of stroke, beginning with number 9, weakness or numbness. The early sign of weakness or numbness during a stroke stems from the interruption of blood flow to the brain, which in turn hampers the brain's ability to send signals to various body parts. Let's delve a bit deeper into why this happens. When a stroke occurs, the affected part of the brain struggles to send necessary signals to muscles and skin, leading to sensations of weakness or numbness, predominantly on one side of the body. This sudden onset of weakness is often the body's way of sounding an alarm that something serious, like a stroke, is underway. Your muscles might feel floppy, or you might experience a sudden loss of strength. On the flip side, numbness might render you unable to feel anything in certain parts of your body. According to a publication from the National Institute of Neurological Disorders and Stroke, the sudden weakness or numbness in the face, arm, or leg, especially on one side of the body, is a hallmark sign of stroke. This is your body's SOS, signaling that the brain is not communicating effectively with the muscles or skin due to the interrupted blood flow. But there's more to it. The brain is a complex organ, and when a stroke hits, the aftermath can ripple through the neural pathways, leaving a trail of disruption in its wake. The numbness or weakness you feel is a tangible manifestation of these internal disruptions, making it a crucial early warning sign of stroke. Next, number 8, trouble speaking. When you or someone you know suddenly has difficulty speaking, it could be an early sign of a stroke. Why? Your brain is an incredible organ. It controls everything, from moving your fingers to constructing complex sentences. To do this, it relies on a network of blood vessels to bring it oxygen and nutrients. If there's a blockage or a bleed in one of these vessels, a specific part of the brain might not get what it needs. This interruption is what we call a stroke. The region of our brain responsible for language is primarily in the left hemisphere, known as Broca's and Wernicke's areas. When these areas are deprived of oxygen, even momentarily, they can't function properly. This results in speech difficulties. Remember, if someone is having trouble speaking, don't dismiss it. It's essential to act swiftly and seek medical attention. Knowing these early signs might just save a life. Next, number 7, vision problems. When someone suddenly starts experiencing vision problems, it could indicate a looming stroke. The reason? Our brains are intimately linked to our sight. Vision is regulated by several areas in the brain, most notably the occipital lobe. If blood flow to this region gets disrupted due to blockage or hemorrhage, vision can become compromised. This means blurriness, blindness in one eye, or double vision. Research has consistently shown the connection between vision issues and stroke. A study in the Journal of Neurology, Neurosurgery and Psychiatry in 2018 highlighted that many stroke patients reported vision disturbances as their very first symptom. While vision changes can be attributed to various causes, it's crucial not to overlook the potential risk of a stroke. A sudden vision anomaly isn't just about eyesight, it's your brain sending a distress signal. Next, number 6, severe headache. Severe headaches can be an initial warning sign of a stroke due to increased pressure within the brain. This pressure intensifies because a stroke either induces bleeding or obstructs normal blood flow. Why does this matter? Well, the brain is enclosed within the rigid structure of the skull. When blood leaks or is obstructed, it creates pressure against the brain's delicate tissues, triggering an intense headache. A comprehensive review of stroke symptoms in a 2020 publication in the journal Neurology emphasized the relationship between sudden, severe headaches and onset of a stroke. This research revealed that headache prevalence is notably higher in cases of hemorrhagic strokes, showing up in approximately 6% to 44% of the reported cases. What this means is that in a significant number of cases, severe headaches preceded more traditional stroke signs. It's vital to take severe headaches seriously, especially if accompanied by other unusual symptoms. Seek immediate medical assistance, as timely intervention can make all the difference in treatment and recovery outcomes. Recognizing and responding to the signs early is crucial. Next, number 5, dizziness. Dizziness occurs because strokes often affect the brain areas that coordinate balance and movement. When blood flow to these regions is impeded, the sensation of stability your brain typically provides gets disrupted, making you feel unsteady or experiencing vertigo. According to a 2011 study in the Canadian Medical Association Journal, patients who experienced dizziness alongside other symptoms were more likely to have a stroke than those who didn't. The study underscored the importance of recognizing and promptly responding to these subtle warning signs to prevent severe impairments and facilitate better recovery. Another pivotal 2007 research in stroke emphasized the connection between sudden dizziness and vertebrobasilar strokes. These types of strokes affect the back of your brain, explaining the occurrence of balance and coordination issues. In situations where dizziness is sudden and severe or accompanied by other stroke symptoms, immediate medical attention is crucial. Next, number 4, difficulty swallowing. Experiencing difficulty swallowing, known medically as dysphagia, might alarm you, and for a good reason. It can be an early sign of a stroke. Let's dive into why. Our brain, an intricate powerhouse, has specialized regions that coordinate actions we often take for granted, like swallowing. A specific part of our brainstem is pivotal in the process of swallowing. When this area doesn't receive adequate oxygen due to compromised blood flow, swallowing can suddenly become a challenge. A research article from the International Journal of Stroke in 2016 highlighted the connection between dysphagia and stroke. The study found that up to 65% of acute stroke patients experienced some form of swallowing difficulty. So, if you or someone you know struggles to swallow unexpectedly, it's crucial to be vigilant. Next, number 3, unilateral facial droop. Have you ever seen someone's face suddenly droop on one side? It's unsettling, isn't it? That unilateral facial droop could be a telltale sign of an impending stroke. Let me explain why. The brain is a maze of neural pathways, each governing different body functions. The facial muscles, crucial for expressions, are controlled by the facial nerve. This nerve, like all parts of our brain, needs a consistent blood supply to function. When there's an interruption to this blood supply, due to either a blockage or bleed, that specific region struggles to do its job. This is why we see a droop. The affected part of the brain can't send the proper signals to the facial muscles on one side. Now, here's where research chips in. A pivotal study in the Omen Medical Journal, 2019, indicated that patients with a sudden onset of unilateral facial droop had a significantly higher risk of having an acute stroke. Next, number 2, nausea. Nausea might seem unrelated to the brain, but it's more connected than you might think. When someone feels sudden nausea, especially paired with other symptoms, it could be an early sign of a stroke. Our brain has a region called the insular cortex involved in various functions, including our perception of disgust and pain. If a stroke affects this area, it can lead to feelings of nausea. Moreover, the brainstem, which helps regulate basic bodily functions, is close to the areas that handle balance and coordination. Any disruption here due to lack of oxygen can also result in nausea. A 2019 article from the journal Neurology discussed how stroke symptoms often present differently in different people. That highlighted that non-traditional symptoms like nausea should never be overlooked. Next, number 1, seizures. Seizures happen when there's abnormal electrical activity in the brain. Now, you might wonder, how does a stroke fit in? Well, when a part of the brain suddenly doesn't get the oxygen it needs due to a blocked or ruptured blood vessel, it can react by sparking this erratic electrical activity. An enlightening research article in the Neurological Research and Practice from 2021 highlighted that seizures, especially in the early stages of a stroke, are more commonly associated with lesions in the cortical area of the brain. This is the outer layer responsible for many high-level functions. What's crucial for you to grasp is that if someone experiences a seizure out of the blue, it could be their brain sending an SOS because of a potential stroke. Thanks for diving deep with us into the mysteries of early stroke signs. Knowledge is power, and today you've empowered yourself. If this information resonated with you, give us a thumbs up and share it. You might just help save a life. And hey, don't forget to hit that notification bell. We've got more enlightening content coming your way. Together, let's keep the conversation going and make a difference. See you in the next video.